We conducted a biomarker sub-study of the so-called TIM-HF2 study, which has been a telemedicine study showing that patients with heart failure profit from telemedicine if they had at least one hospitalization within the last 12 months, and they have a lower mortality when they are allocated to remote patient medicine, as we call it today. And now we saw that the standard of care group, which was a control group in this study, there was a substantial portion of patients having no events. So we thought that this is a group of patients who cannot profit from the intervention, and we conducted a study to identify these patients upfront. We used the same primary endpoint as the TIM-HF2 study, which is percent lost days, and due to cardiovascular hospitalization or mortality, and as a secondary endpoint, all-cause mortality. And the design was that we identified cutoffs for two biomarkers, which are NT-proBNP and MR-pro-adrenomedulin, and selected patients who were not recommended for remote patient management. And then we looked in the originally randomized cohorts whether the effect of remote patient management is still there. Findings are that with cutoffs of 0.75 for MR-pro-ADM and 420 approximately for NT-proBNP, we can select a patient group which is 27% of the original group who probably will not profit from remote patient management. And when we look at the remaining group, approximately 1,000 patients, we saw the same treatment effect of remote patient management as in the original study. So I think that these study results will definitely influence clinical practice, as it allows us to better select a patient group who will profit from remote patient management, which is a measure which is highly costly, so it's not a cheap measure. And we saw that the number needed to treat comes down from 28 to 21 if we use the pre-selection by biomarkers. And we think that we can better allocate this costly measure to the right patient group. Although this is, I think, nearly definite, I think we need further studies to add other biomarkers maybe, and also to prospectively confirm that in specific subsets of patients with heart failure.